One of the big deliverables for CQC this year has been the registration of the NHS, and that included, of course, delivering the guidance about compliance so they knew what the standards were that they'd got to meet. So we got to deliver that in time for them to be able to look at it before they began their registration applications. We then successfully registered 378 trusts against the new registration requirements for the 31st of March 2009, and that was a fantastic achievement both for the NHS, who got hold of the new system and responded really positively to the demands of a very different quality regime for them, but of course for our staff. So at the same time as developing a new regulatory model under the Health and Social Care Act, we had to conduct the business as usual under the Care Standards Act. So we visited over 11,500 providers of adult social care. We visited 5,000 detained patients under the Mental Health Act provisions to ensure that their rights were being upheld and that they were being treated in a safe way. And we conducted 250 inspections of NHS organisations to look at healthcare-associated infections and to make sure that they were compliant with the Code of Practice. Throughout the work of the Commission over the last year, not only have we had to process an enormous amount of work, but we've also had to be true to the values that really underpin the organisation and, frankly, the values that drive our staff, which are about putting users at the centre of everything we do, ensuring that diverse voices are heard throughout that process, and making sure that when we're working with services, the perspective of users and what quality really means to them is reflected in everything that we see.